Hey, it's Dr. Stuart Rammell with Pinnacle Pain and Spine. I'd like to just take a few minutes today to talk about one of the common interventional procedures that we offer here. Now, pain in the spine, in the neck, mid-back, and low back can come from multiple sources. One of the sources is what's called the facet joints. The facet joints are essentially these small joints that connect the intervertebral segments to one another. Now, with age or increased activity and over time, these facet joints can become irritated, inflamed, and cause pain. We have a procedure called a radiofrequency ablation where we go in and we use electricity to ablate the small sensory nerves that bring sensation back from these small joints. This is a model of the low back or the lumbar spine, but it also applies to the mid-back or thoracic spine or the neck, also called the cervical spine. Now, in order to be a candidate to have this radiofrequency ablation procedure, we do a set of diagnostic blocks, something called a medial branch block. That's the name of the small sensory nerve that is bringing sensation back from the joints. Now, that procedure is done very similar to the way that the radiofrequency procedure is done, where under live x-ray, we will place small needles onto where those nerves run, and then we'll put them to sleep temporarily with a little bit of local anesthetic. And then we'll have you record over the next several hours how much pain relief you have and how much improvement in function that you're having. And if you get a significant amount of pain relief and improvement in function during the duration of the local anesthetic block on two separate occasions, then you would be a candidate for the radiofrequency ablation procedure, which can offer some prolonged relief. Now, the radiofrequency ablation procedure is done very similarly, where the radiofrequency cannulas are placed through the skin. An electrode is placed into each of those. We test the nerves to make sure that we're only ablating the sensory nerve coming back from that small joint, and then we heat up that electrode and it causes an ablation of those small nerves. Now, this procedure can be done under local anesthetic or can also be done with a little bit of light IV sedation. Now, this is a procedure that we do very commonly, and many patients do very well with this. It's something that can help get you back to doing what you want to do and enjoying your life more. So if this is a procedure that we've already talked about in our clinic and you're getting ready to have the procedure, best of luck.